Good afternoon. My name is Dave Kerner, serving as County Mayor here in Palm Beach County. We're located, of course, at the Emergency Operations Center of Palm Beach County. It is August 14, 2020, day 153 under emergency order and activation of our Emergency Operations Center. I'm joined here today by my colleague, Commissioner Mac Bernard, who's going to be giving an update on some census data information, and I'd like to give the residents of Palm Beach County a brief update on COVID-19 and where we stand and where we look to go. Total number of cases in Palm Beach County at this point is 38,575. Of course, that means that that's how many people have tested and were positive since the beginning of testing in Palm Beach County. That's not the number that is are positive right now. Our increase from yesterday was 367 cases. A total of 291,132 people have been tested in Palm Beach County, and our most recent data indicates that we unfortunately have lost 976 Palm Beach County residents to COVID-19. We've had some very good trends in our daily lab rates, which is a positivity rate, which is the best metric to examine the prevalence of COVID-19 within our community. As of Thursday, August 13th, yesterday, it was 6.5%. We remain cautiously optimistic regarding our daily positivity rate. I can tell you from my perspective, as I analyze the prevalence of COVID-19 in our community and the impacts that it's having on us and how much work we have left to do, the daily positivity rate is a metric that I focus on because it's very accurate in determining just how widespread the virus is in our community at this moment, whereas a cumulative rate, which is one that we've heard about throughout this entire pandemic consistently, is out now at 13.3%, but that's a measure of how many people have been infected with it throughout the entire county since the start of the pandemic, and so that's a very important metric for some of our doctors and scientists that look at in determining what the full import and impact of this pandemic has been. But in terms of where we are at right now, I continue to stay focused on the daily positivity rate so long as it's accurate. Our mask order has been extended. I discussed that last week by our County Administrator, Ms. Virginia Baker. We remind you that the wearing of masks is mandatory in Palm Beach County. You can consult the executive order about the confines of that order, but you're greatly appreciative of all the participation and cooperation from the community at large. We do believe that it is really driving down the amount of spread in this community, which is a result of, or the daily positivity rate is what is the reason why it's gone down over time, and it's been going down consistently, I would say, over the last 7 days. I want to give you an update on some of the testing issues in Palm Beach County. We're working in partnership with the Village of Wellington and Premier Family Health for a free walk-up testing at the Wellington Community Center. To date, there are 115 government and nonprofit commercial testing locations in Palm Beach County. So when we talk about going into further phases deeper into our economy, one of the metrics that I would use, and I'm sure the colleagues on the Board of County Commissioners will use when we make that decision, is the prevalence and availability of testing. So with 115 testing sites, government, nonprofit, and commercial, that is a wonderful and high-level access to testing in this county, and that is something that will need to remain here throughout the pendency of the pandemic's prevalence in our community. If you have any questions about where you can find the testing locations, whether they're state-supported, county-supported, nonprofit, or commercial, you can go to pbcgov.org. Again, pbcgov.org. I remain in constant contact with the governor's office and the governor himself, as does the county administrator and senior staff. They continue to provide the necessary resources to this county to get through this pandemic in a cooperative fashion. I'm also excited to announce that the Antigen testing program is coming soon to the ballpark of the Palm Beach's testing site. An antigen test is a rapid test with results within hours. Obviously, the availability of those tests is an important metric, but to have them here in our county, there's a myriad of uses that this can be used for effectively. And I would say, for example, antigen testing would be very useful for our first responders, deputy sheriffs, police officers, fire rescue, so that we don't have to put them into quarantine for 14 days, thereby losing very essential personnel and staff that need to be out on the street protecting us. The criteria for antigen testing, which will be available to the general public, should be 65 years old or older, or under the age of 18 or symptomatic at any age. So we are providing this type of test to the general public so long as you meet one of those criteria. You should be over 65, 65 or older, under the age of 18 or symptomatic. A little technical information about the antigen test. It detects proteins from the virus. That means that a positive result is highly accurate. I know that there's been some controversy and debate about the veracity of some of these tests that the general public can access and use at home. But this means that a positive result is highly accurate, but a negative result does not rule out infection. Therefore, molecular tests, also known as PCR tests, detect genetic material from the virus. These tests are currently available at all Palm Beach County locations. A COVID-19 antibody test, also known as a serology test, is a blood test that can detect if a person has had or has antibodies to the SARS-CoV-2, the virus that causes COVID-19. COVID-19 antibody tests can help identify people who may have been infected with the SARS-CoV-2 virus or have recovered from the COVID-19 infection. In short, the antibody test is currently available at the ballpark of the Palm Beaches and the South County Civic Center site, and they are available to the general public. Let me speak briefly about our phase 1 and the businesses that remain closed. I know throughout this entire process there has been limited access to restaurants and different venues that are allowed to be open in phase 1, and we know that's a financial strain on those businesses. But I want to remind the community that those that are in phase 2 have never been allowed to be open, and the county understands their pain. We hear it, we share in it, and we will continue to look to ways to assist those businesses that have never allowed to be open since the emergency order came out. Obviously, and I'll talk to this after I let my colleague Commissioner Bernard speak, I will talk about some phase 2 issues, but I'd like to remind the community that the Board of County Commissioners will next convene on August 25th at 9:30 a.m. You can view that discussion and that board meeting on Channel 20 or from the county's website, pbcgov.org. I can promise you that every county commissioner that serves presently on the Board of County Commissioners gets briefed daily on the metrics, on every aspect of this pandemic in this county. Certainly that legislative decision will be made at some point in time. I'll talk a little bit more about this because it is intertwined with the opening of schools in Palm Beach County. But before I get to that, let me turn it over to Commissioner Mac Bernard. Sir.
Thank you very much, Mayor Kerner. My name is Mac Bernard, County Commissioner for District 7. Just really excited that we are going to have the Antigen testing in Palm Beach County next week at the ballpark of the Palm Beaches. It is a testament to the hard work of our staff, the mayor, the commissioners, and the community as we combat this virus. We have many of our residents who are home, and they've received information regarding the census, and they haven't completed the census yet. But what I do want to let you know is that nationally, 63.6% of the residents of the United States have completed their census. And in the state of Florida, we are at 60.4%. And we need to ensure that every resident in Palm Beach County is counted for the 2020 census. Today's response rate for Palm Beach County is at 61.1%. Now, the question that you must ask yourself, can we afford to lose 38.9% of the dollars if you're not counted? And what does that mean? That's 1/3 of the healthcare services that we are getting today that we can lose because residents are not counted. We must make sure every household in Palm Beach County is counted. I want to thank the media, who's been a great partner with us to get everyone counted, but we're at 61.1%. We have to get to that 100%. Responding to the 2020 census online, you can respond online, on paper, by phone, or in person with a census taker as vital for the resources in our community. The Census Bureau will follow up with some non-responding households by phone. And the reason why we're providing this information to the residents is, the census, because of COVID, because of this pandemic, they're changing their way that they typically would do these census operations. So we're providing that information to our residents. In order to supplement their capabilities to send census takers to household in person, the Census Bureau is training census takers to follow up with households by phone, using information provided to the Census Bureau and third-party purchase data. The Census Bureau has a strong contact list for both landlines and cell phones assigned to houses on the Census Bureau's address list. These phone calls will enable the Census Bureau to have the maximum flexibility for conducting field operations and is one more method that the census takers can use to reach non-responding households. If a voicemail is available, the census taker will leave a message asking the household to call one of the Census Bureau's call centers. Census takers have begun following up with households nationwide. Census takers will continue to follow up with non-responding households in person and will follow CDC and local public health guidelines when they visit your household. Additionally, the Census Bureau is sending a 7th mailing. Imagine, they've sent 6 already, but they're sending a 7th mailing, including a paper questionnaire to the lowest responding census tracts. The Census Bureau is emailing households in low responding areas. The Census Bureau recently announced that households in low responding areas would be receiving emails to encourage response to the 2020 census. The emails will go to all households that Census Bureau has contact information for in census block groups with a response rate lower than 50%. This will include households who may have already responded. In total, the Census Bureau expects to email more than 20 million households nationwide in these low responding areas. The email messages will come from 2020 census at subscriptions.census.gov and will give recipients the option to opt out of receiving future messages. Again, residents, this is County Commissioner Mac Bernard. We're urging you to please complete the census because we would lose billions of dollars in Palm Beach County if you're not counted. Thank you.
Thank you, Commissioner Bernard. All right, so I want to take a minute to talk about the overall issue of compliance, education, tools that we can use in this county so that we can get to phase 2 and so that we can get our children back to school. I can speak on behalf of the Board of County Commissioners on this issue because I know that each and every one of us understand the importance of getting children back to school safely, how important it is to their growth and development as young men and women. And it's not a yes or no question. So let me first talk about our COVID education compliance team, because one thing that will have to happen, and we know that when schools do open in whatever format that they open, there's going to be in some regard a rise in infections. And the lower our positivity rate is, the harder it is for the virus to spread. Yes, it's great to know how prevalent the virus is in our community, but the real measure and impact and power of a low positivity rate is that, like Dr. Alonso has said, it's harder for that virus to jump to the next person because it's not prevalent, or it's not as prevalent the lower that it is. So we continue to work on that metric. And in that regard, these rules and laws and orders from the governor and the county are not self-executing. And so the county very passionately convened the COVID education and compliance team. This is just a little snapshot of, we call this the dashboard, and this is available online at pbcgov.com. But it shows where the emphasis and focus and enforcement of the COVID education compliance team has been thus far. You're not going to glean a whole lot from the graph itself or the map, but at least you can see where the team has been. They've been out to West County. They've been in every corner of this county And that's the beauty of a multi-jurisdictional task force like that. There have been 3,575 complaints assessed, and processed complaints is 1,577. Remember, any member of this community can contact the COVID education compliance team at 24COVID. We've received online complaints, 143, code staff initiated 262, again 3,533 have been assessed or assigned. The team has inspected a total of 1,447 sites. 879 sites were in compliance or received educational input. 67 written warnings have been issued. Civil citations 0, notices of violation 19, re-inspections 41, referrals 88, business closures 27. That is the most up-to-date product of the enforcement team that I can give you. There were some journalists, I think, that emailed me about why they can't see it on the clerk of court docket. It doesn't go to the clerk of court. This is code enforcement. It goes internal to our adjudication system within the county, and there's a system of magistrates. So you're not going to find it on the clerk of the courts. But each and every enforcement action has due process in front of a magistrate. So this team will continue to enforce the rules and regulations. As our positivity rate goes down, this team starts amping up its efforts on enforcement. We are turning the corner again, I said this last week, from education. These business owners know their rights and obligations under the law. We're now turning to enforcement. And we need this element to be effective for our kids to get back into school. We need this element to be effective for us to go to phase 2. We'll also utilize technology in the Combat COVID app. You can download that at the Google Store. It says Apple is pending, but it is live right now on the Apple Store. We have over 6,000 downloads. I've worked with the school board. I've spoken directly with Chairman Barbieri about utilizing this sort of new form of contact tracing, which can only be really accomplished once we get under 5% positivity rate, to utilize it in the schools. It would be free to the school system. For those of you that watch the school board meeting, you know that Chairman Barbieri and I have had conversations about implementing it within the school district here in Palm Beach County. I think it would be a powerful weapon. Putting that aside, to the general public, I hope you will take a moment to look at that app and download it. Miami-Dade is already utilizing it as well, and we're looking to execute on a regional approach, because we know that even when phase 2 happens, even when school opens, this pandemic is not going away tomorrow, and we need to continue that type of success that we've had thus far. So let me speak briefly about phase 2. It is a legislative decision that the Board of County Commissioners will make. As many of you know, the governor of the state of Florida, Governor DeSantis, has tasked the county mayors for the 3 large counties, Palm Beach, Broward, and Miami-Dade, to send a letter of request to the governor when they're ready, or they believe that they're ready to move into phase 2. For me to send that letter, I need to be authorized by the Board of County Commissioners. This is relevant to the school district opening brick and mortar schools. Why? Well, brick and mortar schools can't be open in District 1, and by implication, that means we have to be in phase 1. We have to be in phase 2 for brick and mortar schools to open. So there's 2 units of government here, and I want to be clear about this. I want each and every parent to understand the process that is going to happen in government to get your kids back to school and what we need to do to accomplish that. Over the next coming days and weeks, like I said, every member of this board will continue to monitor the situation in this county. At some point, we will meet and a decision will be made to make a request through the county mayor to open into phase 2. That request will go to the governor, and he will either grant it, work with me and staff directly to modify it, or deny it. From there, the school board has been elected to make policy decisions for the care and education of our children in the public school system. Now, I agree it's not good public policy to try to open brick and mortar schools in phase 1, but also let me remind the school board respectfully that once we enter phase 2, then that obligation is incumbent upon the school board to decide when to open. Now, I understand that they've decided to open brick and mortar schools 1 week after we went into phase 2. That's a fine decision, and they're empowered to do it. What I would say, though, is once we get into phase 2, the school board needs to evaluate the county's metrics, numbers, positivity rate on an ongoing basis to make sure that it's safe for these children to get back to school. But at the end of the day, for any of this to happen, we have to remain vigilant in wearing our masks, We have to remain vigilant in complying as business owners with the regulations, and we have to remain compliant and focused on keeping our positivity rate down. The metrics and the procedural processes that occur over the next couple of weeks to get phase 2 opened up are really irrelevant as long as we understand that we need to remain focused on our positivity rate and our compliance with the rules. That's how we get our children back to school. And I know that we all share that common goal in this county. We all want to see that happen. We want to see it happen as soon as possible. But above all else, we want to see it happen in a safe manner for these children. With that, I will take any questions that you may have. Anna?
So you talked about the antigen test. When exactly will that be coming to the ballpark?
Sometime next week.
The question is, when is antigen test coming to the ballpark of the Palm Beaches? It will be sometime next week. We don't have a specific date for you.
And do you know how many antigen tests you're going to be getting?
600 to 700 a day.
We'll have 600 to 700 a day available at that site in antigen testing. Any other questions?
Do you know what is the positivity rate that you would be comfortable initiating a phase 2 discussion? Is it 5%, or are you looking for a number of days that it's below a certain level?
I can only speak to, the question is what's my comfort level with, I guess, starting phase 2 discussions with the board publicly. What would the positivity rate need to be? We have a document, and I'm speaking only for myself, because it takes a majority of the board to vote yes to go to phase 2 and authorize me to send that letter to the governor. And each commissioner can use whatever metric and life experience and input that they want. We have a document called the COVID-19 Phase Restart Program. You all have been briefed on it. It's been available. We've discussed it publicly. And the truth is there are 1, 2, 3, 4, 5, 6, 7 different benchmarks that the Emergency Operations Center gives to us in our daily briefings that they think are important. And so to answer your question, I don't know that there's a specific positivity rate. We've heard about 5%. We are very close to that, quite frankly. I think we're at 6.3 today. That is immense work by the members of Palm Beach County to get to that. We have counties surrounding us that are much higher than us too, which is an interesting revelation. So I would like to see a trajectory that is stable or continues to decline. And 5% for me is I think an important positivity rate benchmark. It's not the end-all be-all of phase 2, but it's something that I think we should focus on. Any other questions?
Is it safe to say that the fact that the school reopening being tied up in the phase 2 conversation makes it a more complicated situation? Like if it was just businesses that were being opened under phase 2, would this be an easier decision?
Well, the question is the phase 2 being linked to the school board being able to open brick and mortar schools, does that complicate our decision-making process? I can tell you it brings more weight to the decision, right? Because we're talking about 180,000 children going back out into their school system, and that can't happen until we make that threshold decision as a board of county commissioners. What I will say that from sort of a practical standpoint is it complicates it in the sense that if we go to phase 2 or we go to a modified phase 2, we know that we're only injecting into this economy, into this community, those businesses and people that are going to go to those businesses. And we may see a spike from that. And now we have to worry about a simultaneous exposure of young children and adults going back into the economy at the same time. That can provide some complications. You know, I've read about some staggered starts and things of that nature. I haven't been able to follow the school board that closely in that regard. We have a lot of stuff going on in the general government. But I have fears about opening up 2 massive, basically, institutions, phase 2 businesses and the school board at the same time. I hope that we can continue to work with the school board to find a way to stagger those 2 approaches.
Has there been any talks with the school board about rapid testing and trying to get that for them for when teachers come back?
The question was, and thank you, Anna, for the question. The question was, has there been any discussions with the school board and their leadership about rapid testing and probably some of the other infrastructure like PPE that the school board needs? Let me say this to the school board respectfully, because we've been dealing with the general government issues, PPE testing, antigen testing, you name it, sending masks out to 660,000 households. I would say for the school board to do this effectively and safely, I think this goes without saying, they really need to have a very robust supply chain, a very robust plan about how to get these children in and out of school daily safely, how to social distance, making sure masks are worn. Those are policy decisions that the school board needs to take on, and they need to get the funding for it, and we'll be here to assist. But I do trust that their focus, senior leadership is focused on the supply chains as well. Because what I would hate to see happen, and we've seen this happen, and we'll probably see it less as time goes on because the supply chains are able to re-up more quickly now. What I would hate to see is an excellent plan be executed and then a bump in the road, like something like antigen testing that has been part of the process for them, disappears. And then now we're 4, 5, 6, 7 weeks into an otherwise successful school year, and then one of the major components of that plan fails. And so I'm sure they have excellent procurement officers. I'm sure they're working with our EOC staff. I talk with Chairman Barbieri on a weekly basis. We're happy to help. But that was sort of a thing that snuck up on us throughout all of America, quite frankly, was making sure we had those supply chains open and accessible.
I know Miami-Dade County has fined a number of people for not wearing masks. Are we doing that in Palm Beach County, and do you have any idea how many people have been fined at this point?
So the question was, Miami-Dade and I think Broward County have had to cite general members of the public for not wearing a mask. Are we intending to do that in this county? I don't want to speak on behalf of Sheriff Bradshaw, but I can tell you that I am certainly comfortable with the level of compliance in this county. And let me remind the public that all the enforcement measures that we've taken thus far have been against businesses that are not operating, not individuals, the everyday citizen going down the street. And I think that at this point, Palm Beach County is united in their goal. Yes, we're continuing to get sued for our mask mandate. We won the first round. They're going to appeal it. You're going to have those people that just think, it's a violation of their liberty somehow or whatever. We're happy, I'm happy with the level of compliance that we see in the day-to-day lives of the people of Palm Beach County. If the sheriff or his deputies or a local police department decides to take that action, I trust that they took that enforcement action because it was necessary. And we've seen it actually play out in the Keys as well, where they have a big tourist population, and they're trying to balance that. I think in our county, we've been blessed and lucky to have really broad compliance, so I don't think we'll have to go there.
My last question. You talked about how important antigen testing is for first responders. Are they going to be the first ones, like first come, first serve for that population?
Not necessarily. The question has to do with antigen testing and whether the access to it will be provided to first responders first. I don't think that's necessarily true. The general public does have access to this test. What I will tell you is that there have been modifications made so that first responders can get tested quickly and get the results quickly. For example, some of the protocols for those of us that work in the Emergency Operations Center, we have to be tested once every 2 weeks. And we get that test result back in 1 day, because if you have an outbreak in this building, it can destroy the continuity of operations of the entire county. So we do make provisions for our first responders, and I think the reason why is obvious. But those tests are available to the general public, and they will remain to be. All right, I think that covers a lot. We have a nice weekend ahead of us. I appreciate all the cooperation and the civic-minded participation by the members of Palm Beach County. We'll continue to update you regularly, and thank you for being here.